Hello and welcome. Today we're diving deep into a condition that affects the mouth and can have serious long-term consequences: oral submucous fibrosis, or OSMF. This debilitating disease impacts the lining of the mouth, throat, and sometimes even the esophagus, limiting jaw movement and significantly affecting quality of life. So, what causes this debilitating condition? The primary culprit is the habitual chewing of areca nut, often in the form of betel quid, gutka, or pan masala. Areca nut contains alkaloids that stimulate fibroblasts, the cells responsible for producing collagen. While less common, other potential factors may include deficiencies in iron, zinc, and certain vitamins, as well as genetic predisposition and autoimmune conditions. The exact interplay of these factors is still being researched. Let's delve into the pathophysiology. The areca nut alkaloids trigger an overproduction of collagen in the submucosal layer of the oral cavity. This excessive collagen deposition leads to progressive fibrosis, meaning the tissue becomes stiff and scarred. The blood vessels in the affected area also become damaged and constricted, further reducing blood supply and contributing to tissue rigidity. The epithelium, or the surface layer, becomes atrophic and vulnerable, increasing the risk of ulceration and, concerningly, malignant transformation, meaning it can turn into cancer. Oral submucous fibrosis is predominantly seen in South Asia, Southeast Asia, and in migrant populations from these regions. Countries like India, Pakistan, Bangladesh, and Sri Lanka have a particularly high prevalence. The condition is more common in individuals who frequently chew areca nut products, and the risk increases with the duration and intensity of chewing. While traditionally more common in older adults, we're now seeing OSF diagnosed in younger individuals due to changing habits and increased accessibility to these products. The signs and symptoms of OSM develop gradually. Early on, you might experience a burning sensation in the mouth, particularly when eating spicy foods. This is followed by blanching or a marble-like appearance of the oral mucosa. As the fibrosis progresses, the mouth becomes increasingly stiff, making it difficult to open the mouth fully, a condition known as trismus. Swallowing and even speech can become difficult. Other symptoms include a change in taste sensation and the development of ulcers in the mouth. These ulcers can be painful and slow to heal. Diagnosing OSMF typically involves a thorough clinical examination of the oral cavity. The characteristic blanching, stiffness, and reduced mouth opening are key indicators. A biopsy of the affected tissue is often performed to confirm the diagnosis and rule out other conditions. Histopathological examination of the biopsy sample reveals the presence of excessive collagen deposition and other characteristic features of OSMF. While various classifications have been proposed, a commonly used system categorizes OSMF based on the severity of the disease and the extent of mouth opening limitation. Stages typically range from early signs like burning sensation, to moderate fibrosis with some mouth opening restriction, to severe fibrosis with significant trismus and difficulty in daily activities. Understanding the stage helps guide treatment decisions. Unfortunately, there's no cure for OSMF, but treatment focuses on managing symptoms, improving mouth opening, and preventing progression to cancer. Treatment strategies include cessation of areca nut chewing, of course. Topical or injected corticosteroids can help reduce inflammation and fibrosis. Physiotherapy exercises are essential to improve mouth opening. Surgical interventions, such as fibrotomy or the use of flaps, may be considered in severe cases to release the bands of fibrous tissue. Nutritional supplements such as iron and vitamins may also be recommended. The best way to avoid OSMF is to prevent it in the first place. The most effective prevention strategy is to completely avoid chewing areca nut-related products like betel quid, gutka, and pan masala. Public health campaigns aimed at educating people about the dangers of areca nut chewing are crucial. Early detection and intervention are also important to prevent the progression of the disease. The prognosis for OSMF varies depending on the severity of the condition and the individual's response to treatment. While the condition is progressive and can significantly impact quality of life, early diagnosis and adherence to treatment can help manage symptoms and improve mouth opening. The most serious complication is the risk of malignant transformation to oral cancer. Regular follow-up appointments and oral cancer screenings are therefore essential. Recent research is focused on developing novel therapies that target the underlying fibrotic processes and prevent malignant transformation, including exploring the potential of antioxidants and antifibrotic agents.